Okay, we'll get started here. So good afternoon, or actually good morning, everyone. Welcome to the PASSHE West virtual session for Highlands Health, Laurel Highlands Free and Charitable Medical Clinic. Thank you for joining us. We are recording this session. Your video, for all the attendees joining, your video and audio will remain muted during the session. If you have questions, please use the chat feature at the bottom of your screen. You may enter a question at any time, but it may not be answered until the end. And Emma Jackson-Harris from our Career Center is also on the call so that she can monitor the chat feature to let us know the questions that are coming through. So at this time, we want to introduce our speaker, Rosalie, from Highlands Health. So we're going to get started with a question and answer segment of our session, and I'm going to stop the screen for a moment so we can go back to just us. Here we go. So if you could, Rosalie, tell us a little bit about yourself and your role within your organization.
Well, hi, everybody. I'm Rosalie Danchenko. I'm the Executive Director of Highlands Health. Our full name is Highlands Health, Laurel Highlands Free and Charitable Medical Clinic. And the name was selected because we serve people in the Laurel Highlands region. So it's just not limited to Johnstown. We go Cambria, Somerset, Bedford County. And honestly, if anybody comes to our clinic and needs help, we don't turn them away if they're from Pittsburgh or Philadelphia or Erie or whatever. We're here to help people. When you use the word free and charitable, that means we're providing services to people who are not insured, as well as people who are underinsured. And that is the mission of our clinic, to serve the low-income uninsured and underinsured residents of Laurel Highlands with medical, pharmaceutical, and wellness services. Myself, personally, I've been with this organization for going on 7 years. I was retired, couldn't stand my husband 24/7, and figured I better get a job, or either I was going to kill him or I was going to have to run away from home. So here I am. I took this job thinking it would be easy peasy, 32 hours, no sweat. Well, let me tell you, it's like running a mini hospital. And anything and everything you can think that is needed to run a hospital is what we need at this clinic. Nurses, doctors, data people, social media people, IT people, human resources people, social media people, Zoom people, just about any marketing people, just about any type of skill or educational background that a student might have. Probably their curriculum could be supplemented by an internship here at the clinic. This clinic is growing. And it's important to say that because we are moving from a clinic that does not accept insurance to a clinic that will be accepting insurance. So that's a whole new process to go through. So anybody in medical management who wants to get into management of a clinic, that is they can get a I'm learning. I never did this before. It'd be great to have somebody come alongside me to have to do it, have to redo every single policy and procedure in this clinic. We've gotten through about a third of them, but you have to reformat it to match something at a federal level. And I could talk a lot. So I guess the point I'm trying to make here is that you tell me what skill you have, and I bet you I can find you a place in this clinic to help the clinic.
Well, very good. Okay. Well, with all these positions that you might have, what do you think? What do you find that employees and interns like best about your organization?
The flexibility and the atmosphere. Um, the philosophy here is we love people to health, which means we get down, we meet the patient where they are. We don't judge. We're not putting individuals through like a meat factory. We look at the total patient and try and help them overcome their obstacles to health. So that's what people will say the most about us is the atmosphere and the true sense of helping somebody who is in crisis and in an urgent need.
Okay, good, thank you. Well, you kind of answered this slightly a little bit, but what do you think makes your organization, in your opinion, unique from other companies?
Again, it is that caring atmosphere. One has to realize that we are serving those that no one else wants to serve. We're serving homeless people. We are serving individuals who are at high risk of chronic disease and have chronic disease. They may not have their medication. They're coming to us sometimes with absolutely nothing. Maybe nothing means not even having soap to take a bath. So when we're working with people, it is really the population that is less likely to ever get served.
Okay. What is something that most people don't know or would be surprised to learn about your organization?
That there is a clinic in this region that provides free and charitable work. That our clinic also has over $2.5 million worth of medication that we're able to provide to our patients, all of which the medications we have found through donation. So this clinic and the very, very limited staff that I have are quite skilled at finding free and being able to supply the needs of people who have nothing. I'm very proud of that. I'm very, very proud of that fact. There's only 2 of us that are full-time here, and there's 3 that are part-time, but my volunteers number over 140. So it is those people that are really giving of themselves. And interns, I love students because they're energetic, because they're full of fresh ideas. They know how to use the doggone computers. They teach me. But I like students who are self-motivated. I like students who want a task that's going to be, it's going to be a meaningful task. You know, if a student comes here and say they are interested in IT, you know, setting up systems, well, then they're going to set up systems. You know, they're going to do that. And I'm hoping that they're at the stage of their college career that they're ready to jump into a job. I don't know how to do it. And last year I had 2 students and COVID-19 took them away. And we were in the middle of moving from one location to another, and we had to set up a whole brand new computer system. You know, we just started electronic medical records. I have retired doctors who retired because they don't want to do electronic medical records, and now they're volunteering here and have to do electronic medical records. It would be great if I had scribes. You know, a student that would be willing to go into the room with the doctor and actually put the stuff into the computer as the doctor is talking to the patient. I mean, what an opportunity for somebody that wants to get into IT or the medical field. Myself personally with administration, becoming a federal qualified clinic, I'm learning as I go. someone that wants to go into health management to say that they came alongside us here at the clinic to do that work to help us become a federal clinic. You know, that's a resume builder.
Now, actually, speaking of that, I'm going to ask a quick off-the-wall question, but with our students who are like bio pre-med majors and they have to do different hours, like volunteer service, things like that, that would be a great match for them to get some exposure to the career field, as well as getting that hands-on experience with, you know, actually even shadowing the doctor as well as doing some of the scribing.
Wow, and they could be in the dispensary. What better place than to look at $2.5 million worth of medication, learn what they're for, learn how to count the pills, how to give them to the pills, and maybe even help the patient understand what the pills are needed. They may be going into pharmaceutical work. Yeah, we've had students here with that type of background, and it was valuable.
Good. Now, I know you did mention the clinic is in the region, so where is your actual location?
Okay, so we're located in Johnstown, Pennsylvania, right on one street over from the main street, because we just moved, and I have to keep remembering we just moved. Got a beautiful, beautiful new office location, twice the size of our own location. So there is, and we have parking, which is kind of cool. Yeah, so we're in our new location now. And then we have a clinic in Somerset. And the clinic in Somerset is 1 day a week. That clinic I'd like to expand, grow. There again, if I had a student that was really energetic and wanted to help to promote in Somerset County, I would love that, but it would have to be a very motivated student because they would be distanced from me.
Okay. As you're looking at candidates' resumes or cover letters, is there something you look for specifically when you're hiring?
I try to match the student's training to something in the clinic. I really look, when I talk to the student, I look for that spark more than I do anything else. You know, I like to hear, I see that your clinic, say they looked at our website and they'd go on and say, you know, your website hasn't been updated, and my background is web development and social media. I have these ideas. And that's the spark I'm looking for.
Okay. And then do you have any tips on what students should do or not do in a job interview?
No negativity. Know a little bit about the clinic before you talk to me. Do some of your homework. If you have a skill, talk about your skill as it would benefit my clinic. Just don't give me yes or no answers. Give me some meat. Tell me about yourself and how you're going to make my clinic better.
Okay, wonderful, thank you. Now you mentioned, you know, some of the positions that you currently have, but do you have opportunities available now for alumni or soon-to-be alumni or even current students within your organization?
Well, the work that I'm doing now for the federally qualified clinic is quite overwhelming. I would love to have somebody that could help me with formatting and getting all these policies and procedures into the federal standard. Love for that. Love for somebody to help me with marketing. Social media right now, social media is a big one. Working in the dispensary, helping them there, that's a big one. IT because my staff are mostly older, and that's all you ever hear is, I can't figure out what to do with my computer. Why can't I get on my computer? I forgot my password. Now that's usually me screaming. I know. I don't know what to do about this doggone Zoom. Somebody come help me. You know, and it's and now that's the world. I just wrote a budget today for a diabetic program. And we want to try to find the low-income uninsured diabetics in this community. You know, developing a plan for how to do outreach in the community. Some students might have educational backgrounds and they want to test their hand at teaching individuals how to best get well with their diabetes. I mean, you don't have to be a nurse to do that. You just need to know how to talk and hit the right points. I don't have a medical background, so let me tell all you out there in cyberspace, I'm a boring administrator, and I now wear this white coat because it makes me look official like a medical person, but I have none. So if I can do it, anybody can do it.
Okay, wonderful. Now, with your positions, I'm guessing they're in-person positions. Do you offer any type of remote work, or do they all need to be in person?
Well, now the world is remote. I guess I'm going to have to get on that course. Yeah, I'm sure we could do remote work. It would take, the person that wants to do remote work would have to teach me how to teach them how to do remote. Got it?
Sure.
No,
I think we're all learning.
Yeah, it's really, oh man. It's, you know, all those policies and procedures review, they wouldn't have to come in the clinic. You know, we could put it up, where do they put them? Google Docs. Maybe that's out of date already, but I know Google Docs is something, we put this stuff in there. Yeah, we could do remote. We could,
Okay.
you know, you could create programs now, like to work in the dispensary, that's all hands-on. To do IT in here, I don't know how you would do that remote. I guess you could. I guess you could, huh? I don't know. I don't know.
I say it's just something that's coming through.
Yeah, somebody could show me how to do that.
Okay. If anyone does have additional questions, feel free to go ahead and put those in the chat feature. But is there any piece of information you'd like to leave our students with before we end our session today?
If you don't have that place for an internship and you think you might be a fit, you should give me a holler. You know, I'm sure some of your students are from this region. I'm sure they are, and you know, there's all kinds of opportunities. We could find a fit.
Wonderful.
I don't know what to say.
Good. Well, at this time, let me see. I don't think, Emma, do you see any additional questions in the chat?
Do I click on that?
No, we
I
do
think
not
Emma,
have any. No, we
okay.
do not have any additional questions.
Perfect. Okay. Well, since we don't have any additional questions at this time, thank you all for attending our session. Thank you to Rosalie for taking the time to share the information and give some inside scoop. If anyone does have additional questions, please feel free to reach out to your University Career Center, and they can provide contact information for our representative. But if anyone, if you need anything, please let us know. But thank you all. Rosalie, thank you again, and stay well, everyone.
You too. Stay safe. Bye.
Bye.